Okay, so we're doing a non-surgical facelift for this young lady. We call it our MMLift. So it really lifts the outside layers of the face and then the inside layers of the face, and like an M. This is already one syringe of Restylane Lyft on the right hand side. We filled in some into her tear trough and into the cheek. We're going to continue the process by you doing a little bit in the nasolabial fold and then in the posterior cheek here. We use a blunt cannula, and the blunt cannula allows us to, I'm going to put your head back, treat these areas without creating any damage or trauma to the vessels, muscles, or nerves in the area. And because we are able to have a longer cannula, it's 1.5 inches, it allows me to get to a lot of different places in the face with just the one needle stick. So because we only have one needle stick, you bruise and swell a lot less. Because every time we stick you with the needle, you have increased chances of bruising and swelling. And so this really decreases the amount of recovery time that patients have after the injections. But because and nobody else does it this way, so once I treat the eyelid, we can then come down and treat the nasolabial fold, and we're cross-hatching this, so it supports the deeper layers of the tissue without filling the fold. So if you fill the fold, you can get a fullness in that area. But if you cross-hatch it from this angle, it really gives you a nice smooth flattening of that nasolabial fold. And that's really what patients want. And now we're going to treat the outside of the cheek here. Again, from the same injection point, or insertion point rather. And we're going to use a fanning technique to treat and place a product very smoothly into these areas. And what the posterior cheek injection is going to start to do is going to start to lift the bottom part of the nasolabial fold and some of this jowling. So set up for me now. You can already see the type of improvement she's getting here in the cheek with the lift, the nasolabial fold improvement, the tear trough improvement, the jowl improvement compared to the other side. And what we're going to do next is to do a little non-surgical neck lift and pull the rest of this up to give her a nice mini facelift result.